We are a mighty group of individuals that advocate on a daily basis for the patient community.
We all bring such a different perspective to the foundation, and we're able to share the patient's perspective.
We educate others about our disease. We advocate for our diseases, and we advocate for MPN research.
Helping to form relationships between the healthcare providers, the researchers, the MPN Research Foundation, and provide a voice for patients that otherwise wouldn't have been heard. Everyone on the Patient Impact Council is either a patient or a caregiver. It's a 2-year volunteer assignment.
There are 13 or 14 of us on the council, all with different backgrounds, all with different perspectives on the disease.
Some who have PV, some who have myelofibrosis.
We offer a true, authentic patient perspective.
This is really the first time that I'm aware of that the MPN community has put together a working group of patients from all different backgrounds
to really take the patient voice into consideration and then do something with it.
So that the outcomes are going to be stuff that matters most to the patient.
Everybody on the council is highly curious and displays an endless devotion to positive patient outcomes.
We've been involved in reviewing the research grants.
We're doing the caregiver information packets that were put together.
And there's a new program called MPN Pathways to train us all about all the research and information that's going on so that we can then educate others and help spread the word and create more awareness.
And we were invited to the MPN Research Foundation Roundtable in the spring.
It allowed us as patients to see the thought process of how scientists are currently trying to bridge the gap between things that are unknown and trying to translate that into clinical applications for patients.
They actually had the council help review the research proposals that have come in and give a patient perspective to the physicians and the researchers. And the feedback we got from the doctors was just amazing.
You know what? I am going to approach patients in a different manner now because of the feedback that I've received.
Our input really has been translated into something that's deliverable, actionable for patients, helpful to patients.
And it felt very empowering to connect face-to-face with those physicians and researchers.
We're also out there in our communities talking to our primary care physicians or healthcare providers, trying to understand what would help, what would be needed, and then bring that back to the Research Foundation and others.
I love it because we, share information and bring information to everyone else, and we all learn from it.
And I've seen nothing but positive things with what we have done.
There's real excitement.
Because of all of the amazing time and energy that everyone on the council puts into everything that they do.
Really helping drive and push that patient perspective.
It's overwhelming for me to see people come together for one cause.
A mighty group of individuals that advocate on a daily basis for the patient community.